So today is a day for breaking rules, and our estimable host knows I've already broken a rule because I snuck in and I changed the first slide. Because here we have a picture of an older woman in an accident emergency department being looked after by someone in uniform. It could be a consultant or it could be a nurse, but someone looking after this lady. The picture that was there before was a picture of an old woman, and the picture itself artistically was fading. And fading is one of the ideas that we always think about when we think about people with dementia. Today I want to talk about some of the deep ideas that we have already explored about the end of life. I want to talk about the role of women, the role of nurses. I want to talk about our psychological health, but I also want to talk about how dangerous it is to come out of the closet. Because there are times when I have come out of the closet with my ideas about dementia and where I found that it was tough. We spoke about tough before. So before talking to anybody about dementia, one of the things I always do is say what it is I understand by dementia, because my experience in this world is that of all the audiences that I speak to, there are lots and lots of people who have a different idea from me about what dementia is. Loads of people think of it as a memory problem because that's what the advocacy organisations and the health education people tell us. You know, things saying, worried about your memory, go and talk to your doctor. So there definitely are memory problems. In dementia, people also get problems with reasoning, working things out. Now, I know there are people watching this in other rooms, but can I say to them that I'm looking at an audience of people who look very respectable? And I guess there's nobody in here who ever wakes up in a hotel room in the morning not quite sure where they are. It sometimes happens to me, and it's because I'm travelling the world talking to people about dementia, wake up in a hotel room, I'm not 100% sure, but I look and I see my briefcase, I see my suitcase, I open the curtains and there I am. Saudi Arabia, Singapore, wherever I happen to be on that day. And sometimes Shetland, sometimes somewhere in Scotland, somewhere nice. But the next morning when I wake up, I'm absolutely clear about where it is that I am, because I've managed to learn that if I had dementia, it would be impossible for me to learn. And you can imagine how stressful that would be. Imagine waking up in the room, not knowing where you are, not being able to work it out, having people around about you who appear not to be telling you what you want to hear. So that's what I think of as dementia. And the other thing is, no matter how much the advocacy organisations make us remember that there are working age people with dementia, and of course there are children with dementia, we have to remember that the majority of people with dementia are old or very old. So they have all the normal changes that come with ageing and some of the abnormal changes that come with ageing, but they've got a reduced capacity to cope with it. I have to remember to have my reading glasses. Oh no, they're not here. They're usually in my hair. People have to remember to have their walking aids, their hearing aids, all the things that really help us in old age now. But when you have dementia, you have a reduced capacity to deal with those changes. And this is a diagram that I use to describe what happens in dementia. It's terribly important to use this diagram because this is not a dementia lecture. This is a lecture about coming out of the closet, about being brave and about dealing with hard. So unfortunately, dementia is a journey where you go downhill. And this is the kind of journey that I would like to have. Now, I'm planning to be 90 years old one day, and when I'm 90, I will have a 50% chance of having dementia as a woman. So I want to stay above the line for as long as possible, where I have mild dependency and I maybe just have somebody who's supporting me at home a bit. And then eventually I might get to a stage where I have extreme dependency and I perhaps have to go in a care home or something like that. That's the journey I would like to have. Unfortunately, lots of people with dementia have a journey that's more like that. Over the same period of time, even if they've got the same level of brain shrink or however you describe the physiology of dementia, a lot of people have go downhill faster than they need to. And the arrows that are in that picture there are the arrows that describe all the things that you can do to make the journey more like the top journey. Because if you were a room full of finance directors in a health board or somewhere else, you would want the top journey for as many people as possible, even if you had a heart of stone, because the top journey is cheaper. The top journey costs less. Now, in my life, everything that I want more costs more. Have you ever seen the handbag that was cheaper but the one you preferred? Have you ever seen the car that you preferred or the house that turned out to be much less expensive? The top journey is a journey which, because the number of people with dementia is increasing at such a rate, as we are older and older and we haven't found a cure for it yet, we can't afford to have too many people doing that top journey because we are going to run out of money. We're going to run out of resource. So it's really important that everybody knows what's on the arrows pointing up the way. And here's where my story about hospitals come. I can be doing all the things that keep me well. There are quite a lot of them. There's not a huge amount of evidence for any of them. Exercise, there's really strong evidence for, as we have already heard today. One of the things for which there is some evidence is, would you believe, a glass of red wine a day. That research comes from the University of Bordeaux. For someone like me, it was a bit of a bore, really, because I don't like red wine. But fortunately, the University of Reading came out with some amazing research that says a glass of champagne has the same effect. Result. And this is actually illustrative of one of the problems with the research about this, which is the research that was done at Bordeaux on red wine was done on humans, and the research on champagne has only been done on rats, but it's good enough for me. Every day, in every newspaper, there seems to be a headline story that says the cure has been found for dementia. In many cases, it turns out that the research has only been done on rats. There was one just last week where the research had been done, and it was on middle-aged rats. I'm not sure how you measure a middle age in a rat. Perhaps they start wearing fawn cardigans or something. A middle-aged rat, and their memories appear to improve for finding their way through mazes after they were electrically stimulated with needles. And the headline was, possible cure for dementia. The rats didn't even have dementia, but it was still published as a headline. The copy editors put inverted commas round the headline, and that shows that when they say cure for dementia, that means even they don't believe it's a cure for dementia. But do you know who does believe it? The families. The families think there's a cure. Sometimes with some of these stories, families weep when I have to tell them that it's not really a cure, or that it's only been done on, and that it's going to be, the person they love is going to be dead and gone before this ever translates into something that is likely to be used in medicine. So what do we do with these arrows? It turns out that very many of the things in these arrows that keep people well are things that are in our control. The glass of wine, the exercise, changes you can make in your house. Just increasing the light level in the place where you live can make more difference in some cases than the medication does. But what happens when you go to an acute hospital? So there I am, coming out of Stirling University, en route to the wine bar, a couple of glasses of champagne, and I fall over and fracture my hip. What happens? I go to the acute hospital. Now, the local hospital there is great, but if I have dementia, the chances of getting back to my previous level of functioning are very, very slim. Quite often when I'm describing this story, people say to me, oh, you must have known my auntie, because this is exactly what happened to her. She ended up going to hospital and she didn't get any better. Extreme dependency set in, extreme expensiveness set in. If this was my mother, I would be really, really cross, because she goes from being somebody who hardly requires any money to look after at all to being somebody who's really expensive. If I was the director of the local authority, I'd be really cross, because this goes from someone who's living at home to someone who's going to be soaking up a huge amount of our local authority further care budget. If I was the hospital manager, I would be furious, because the things that cause the extended length of stay in the acute hospital are actually things that we could prevent. It's a real problem. So we have to start somewhere and start working out how it is we prevent some of those things that happen to people with dementia. And one of the terribly important things we have to do is to make sure that those people who have dementia know that they have got it. This is where I talk about coming out the closet and being brave. I've had stories recently of people with dementia where the family so know this person has got dementia, they've read enough, they know it, and their dad is still driving around in the car. They really want to take the car keys off him, but they can't begin with that discussion. They go to the GP or the doctor, and the doctor says, I'm sorry, you're not my patient, it's confidential, I can't talk to you about it. You hear about people where the conversation has taken place with the doctor, and the doctor does know the person has dementia and has discussed it, but then the person leaves the room, doesn't mention it, perhaps doesn't even remember it. So this spectre of confidentiality and what would happen to you if you breach the confidentiality saves people, it stops people from giving the diagnosis. And this is a real problem for families. So quite often the person discovers that they've got dementia when they arrive at the hospital. And as we know, from the hospital sometimes there is absolutely no exit for the person. The experience of going to the hospital can be very traumatic. All the loving people in the NHS who are trying to do their best do what they can, but what happens in the hospital means that the person with dementia just doesn't go home. We can't afford it financially. It's very difficult for the people with dementia. It's very, very difficult for their families. And so what on earth are we going to do? I was intemperate. I sometimes throw that grenade you're not supposed to throw. And I actually said in a letter to a magazine, I look forward to the day when a doctor would get sued for failing to diagnose somebody as soon as possible. Because I just had this vision of a bus queue of children waiting to go to school being mown down by a person who the doctor had known for ages had dementia, but they hadn't told. And if my child was in that bus queue, I wouldn't have been very happy. I would have been suing that doctor for saying, you could have prevented this horrible accident happening. But the poor old doctors were really, really cross with me. I so should not have thrown that grenade into the bushes because you don't know what's going to happen. I got mobbed on Twitter by really angry doctors saying things like, you know, this woman's wiping her shoe in my profession. She has absolutely no idea how difficult it is to make a diagnosis. So I had created this great division. And so one day, earlier this week, I actually spent the morning with the Crosses GP in the Crosses GP's surgery, listening to the sorts of stories the GP was hearing. And there I had a problem because on the one hand, I said, look, I've been working recently in GP areas where the diagnosis rate was 20%. That's surely not good. That means for every 100 people who've definitely got dementia in that area, who've almost certainly got dementia, only 20 of them have been given their diagnosis and put on the record. They've been given their diagnosis, they've been tried with a medication. It's not necessarily brilliant, but at least you could try. Their family has been given information. They've been given the address of the local Alzheimer's Society. They've been given all sorts of information and support. But only 20% of them, which means many of them will die without ever having been given that support. And the doctor said to me, well, the stats are rubbish. You can't actually believe those stats. The 20% is not true. And I tried to say, well, if you look at the difference between, for example, the Scottish diagnosis rate, which is way up beyond 60%, even the differential between these two diagnosis rates will tell you that there is a difference, that there's something significant happening, but nobody was listening to that. So I started telling stories, told the stories of people that I know who've had dementia and who never gets diagnosed, the family don't get any help, or they have something like a rejection. They arrive in hospital, their cognitive status is not even measured. They go through a hospital experience which translates into falls and delayed discharge. Try to tell these stories and they say, well, that's just anecdotal. That's not real. It's just you talking. So you find yourself in this really difficult bind where you're trying to work out what the best thing is that you can do to try and help people get their diagnosis. And when you come out of the closet, it means that you actually have to say, I am going to tell you that I think you're doing something wrong. And that is such a hard thing to do in the NHS. It's a hard thing to get people's attention and talk about it. The reason why we have to do it is because the only way the NHS is going to survive is if families start doing more. And this is the thing which, not necessarily in Scotland, not necessarily in any other part of the UK, but we need to think about it. It's the thing that the government can't afford to tell us. Now here we are, at the time of this particular TED talk, we're in the run-up to an election. And the NHS is always a big election story, because whoever wants to get in power has to tell the world that whoever is in power is not managing to run the NHS. They're either not spending enough money on it, or they're not supporting it, or they're generally screwing the whole thing up and it's not working. And they have to say, we definitely will make this work, we'll give more money, we're going to make a difference to the NHS. There is not enough money in the world to give the NHS to be able to cope with the number of older people that are going to be in hospital who have either dementia or cognitive impairment of a type that you may as well treat like dementia when they're in hospital because it's delirium or depression, but the treatment or the care for it is the same that you would give. There is not enough money to deal with that because the numbers are increasing. If I think about a report that I did recently on some Welsh hospitals, I spent a lot of time interviewing families who were very, very angry about the amount of care that their family member had in hospital. They were really, really cross. And one of the things that they were saying was, of Of course, we knew the nurses were very, very busy. We knew the nurses had so much to do. But I have to say, my father didn't get washed as much as he did at home because he had so many carers that were coming in at home, but he didn't get any treatment like that in the NHS. And I felt like saying, well, if on the one hand you knew that the nurses were very busy, what made you think that your dad was going to get that level of care? What was it that made you think we would be able to achieve that with all the other things we were trying to do? And it seemed that the families had a fantasy about what the NHS could offer, which is completely out of kilter. Even with more nurses, you wouldn't be able to provide that level of care. And what occurred to me was that the families quite often sat and watched the care not happening and didn't intervene themselves. Why did they not wash their dad? That was the question I wanted to know. And I realised it was something that we, as nurses, were doing. We were somehow or other saying to this family, you can't help. We were having visiting times that were very rigid. Even I have stories in a little booklet that we've produced from the Dementia Centre recently, where the lady offered to come and feed her husband at the time of the meal time, but because of trying to improve meal times, they banned visiting at meal times, so she wasn't even allowed in to feed her husband. So some of the things we try and do to make things better for people with dementia are just not working. But the one thing we absolutely have to do is to come out of the closet and say we cannot, even in acute hospitals, care for people with dementia unless we invite the family to help. And the story always comes and says then, of course, we would like people to come in, but there might be damage or there might be danger. There might be a problem if people come in. They might make mistakes. They might be too noisy. Nurses have to be strong enough to be able to control the people and to help the people, help them to keep care going. The care for people in hospital, people sometimes say, well, what about people who don't have anybody? And the answer is if they don't have anybody, that means that those nurses that are there will be able to help them. Now, to say that nurses are not coping or to say that hospitals are not coping is such an unpopular idea. You're not going to get many Christmas presents. To say that doctors are not doing diagnosis, you're going to get mobbed on Twitter and get into trouble. But everybody here needs to have the courage to say it, because if not, we're living in a dream world. Thank you very much.